Hello, my name is Al-khairalla, a consultant in respiratory and internal medicine. No doubt, the global arena has been witness to the recent unrest and civil strife suffocating Iraq. The future of the country's political landscape is unclear as it goes through this difficult transition. The Iraqi people are courageously uprising against years of oppression in the form of corruption by the political elite, high unemployment coupled with lack of opportunities for the youth, lack of basic amenities, infrastructure, healthcare, education, and security. Undoubtedly, those least affluent in society suffer the most. I will not be discussing the complex political reality of a country divided on its desire for a more secular government, or indeed the battleground Iraq finds itself in due to the by-proxy war of competing regional and distant world powers. My focus will be instead on the topic of healthcare reform in Iraq. In the 1970s, Iraq was a leading nation in the region in healthcare provision and postgraduate medical training. Since then, revolving wars, sanctions, and corruption has led to a profound decline in our healthcare institutions. In recent years, we have observed a ruthless campaign targeting the healthcare profession, particularly against specialist doctors. I and many other victims have been on the receiving end of threats coupled with frequent physical and verbal abuse. Some colleagues have received death threats. Others have indeed suffered kidnapping and murder. No doubt, the recent anarchy and lawlessness have escalated this awful reality. Moreover, although this campaign is driven by a few individuals, we see an increasing number of sympathizers on social media circles who support this negative campaign. It is prudent that I attempt to raise awareness and clarity the current challenging aspects facing healthcare provision in Iraq. This way, we as a people and a nation can identify the real issues at hand and propose constructive ways in dealing with the problem. The Iraqi National Health Service is, in my opinion, beyond repair. When we make a direct comparison against advanced healthcare settings in the Western world, we see that those systems allocate from their national budgets anything between $3,000 to $6,000 per individual per year. Iraq, in contrast, allocates a humble $120 per individual per year. That is more than 35 times less to what other countries allocate in order to provide adequate universal health care. Furthermore, this amount doesn't account for the wastage due to the stagnating problems in false employment, inefficiency costs, and corruption. The private sector is an alternative option. It is predominantly set up as individual specialist outpatient clinics. These clinics have high running costs. They also negatively impact on the work-life balance of individual doctors who have to balance their roles in both the public and private spheres, fighting conflict of interest, exhaustion, and any real opportunity to conduct clinical research which could help advance science and healthcare provision in our country. These clinics can be difficult to regulate by the Iraqi Medical Association in order to provide high-quality, evidence-based medicine and regulate against those extremely few individuals who may see it as an opportunity to carry out extortion against vulnerable patients. Private hospitals also exist. They rely heavily on foreign recruits. This can add to the cost of diagnosis and treatment, not to mention the lack of continuity of care needed by most patients. As a senior examiner of the membership of the Royal College of Physicians PACES exam, the official Royal College of Physicians of Edinburgh regional advisor for the south of Iraq, and an active supervisor of specialist training in respiratory and internal medicine both in Iraq and the United Kingdom, I can openly unreservedly and wholeheartedly claim the following observations. Iraq's borders contains a large asset of gifted, motivated, driven, and extremely talented cohort of junior doctors, senior doctors, pharmacists, and many other skilled professions allied to medicine. There is no doubt that most match the talents of individuals I was privileged to train and work alongside in the United Kingdom. This comparison may come as a surprise to some, but it's based on real frontline exposure in the heart of Iraq since I embarked on setting up National Respiratory and Medical Services in 2015. They are an asset yet to be discovered by not only outside observers but sadly the Iraqi people themselves. There are, of course, many reasons why they receive little recognition. The reason that stands out most is the lack of healthcare systems. The absence of such systems leads to less exposure and training in high-tech diagnostic modalities. It also leads to a lack of continuity of care and a filtering process that distributes patients depending on clinical need and clinical need alone. There is no doubt that Iraq's healthcare reform should start by supporting and embracing this local talent. Interventions such as creating healthy, professional working environments that allow clinicians to thrive and prosper through a more healthy work-life balance that prevents physical and mental exhaustion, an environment that offers audit to ensure patients receive the highest standards of care, and clinical governance to ensure a safe environment in which they are treated. Creating such an environment would help reverse the current high, one-way efflux of highly skilled doctors to neighbouring countries and beyond. After all, the country has invested in training this relatively small number of doctors to help prioritise serving the people of Iraq. All these doctors wish for in return is an environment that allows them to thrive, prosper, and work in dignity. Sadly, those few individuals who drive or support a systemic campaign aimed at indiscriminately ostracizing all doctors in Iraq must stop immediately. Unfortunately, with a failing public healthcare sector, doctors find themselves on the front lines directly on the receiving end of many disgruntled patients and their relatives who have to forfeit significant out-of-pocket expenditure in order to receive basic healthcare. The people of Iraq need to understand that their wrath should be targeted at policymakers in local and central government in order to create any desirable change. Working together as a nation, I believe we can find amicable and practical solutions that would help enhance the quality of healthcare provision at a subsidised and affordable cost. There are many models that can help, such as creating public-private partnerships, healthcare insurance, a focused public healthcare fund to prioritise emergency medicine, cancer medicine, maternity, children and public health. The creation of pharmaceutical companies that can help manufacture 80% of generic drugs as a cheaper, quality-controlled alternative to help keep in remission prevalent diseases such as heart disease, high blood pressure, diabetes and asthma. Such schemes can help significantly enhance the quality and affordability of healthcare in Iraq. I hope that those watching this video recognise the unstable and insecure environment doctors, patients and professions allied to medicine face every day in today's Iraq. I hope it can help challenge the negative rhetoric currently facing the doctors of Iraq and replace it with a campaign that embraces them instead.